Good morning, one and all. This is actually an out of syllabus topic, but I think so many of you are interested, so I can speak about it. How the opportunity came to me. I had been a guest editor for pediatric anesthesia issues of World Clinics in critical care anesthesia and pain. So after these were published by JP Brothers Medical Publishers. So after that, chairman approached me and he suggested me about the book. I was a little apprehensive because it's a giant academic adventure. Anyway, after he left my house, I thought of Dr. Nandini as an excellent co-editor. And then we started working on it. So it's actually a partnership process. And of course, it's a teamwork. Publishers and editors work with authors in a spirit of cooperative creativity. As it is a giant project, but it's also a learning process. It really nurtures the values of discipline, dedication, passion, and commitment. But I must say it's also stressful but enjoyable, and it is time-consuming but satisfying at the end. The whole journey of writing a book, it's a long one, tedious one, and takes time. So you need to go step by step, and the steps will include define the objective of the book, developing the plan, establish the contract with the publisher, defining the roles of responsibilities of editors, choosing the authors, establishing guidelines and conveying those to the authors, informing authors about the copyright and permissions, choosing the format and layout, choose the photo collection, choose the cover design, binding, and then editing, re-editing, proofreading, review, and revise. So the first step is defining the objective of the book. We did not want just the compilation of the didactic lectures, but we wanted to ensure accurate, authentic, adequate contents are presented, and those are also presented in the right manner with proper, consistent format for the spectrum of anesthesiologists. At the same time, it is extremely important to filter out minute mistakes with nuances with hawk's eye. That's a very, very important job. So the step 2, developing a plan. You cannot have a goal without a plan. So you have to chalk down what all steps you have to take. So we did refer to few books, and then we decided to have the perfect table of contents of our own format and covering all aspects of pediatric anesthesia. All the chapters have to be divided into different sections. We had to decide the contents of the appendix and the most important, choice of the authors for appropriate chapters considering their area of expertise. After that, after we chalked down all these things on the paper, we had to communicate to the authors, take their verbal consent. In fact, we called up each and every author personally and then took their consent for contribution to the book. Then we had to give them instructions regarding the guidelines for the text, tables, and images. We had to give them instructions regarding the format of presentation, how the contents will be presented, starting with introduction and ending with summary or in conclusion, and proper references. We also had to give frequent feedback to the publisher. Publisher does keep ringing, whoever is aligned with us. The next step is having the contract with the publisher. So the editors have to sign the contract with the publisher. And the contributors' agreement is also done. It is important to have the reputed publisher for a proper visibility to the professionals. Now, what is our responsibility? Editor's responsibility involves checking the completeness of the manuscript with appropriate contents, checking the style of writing and correcting mistakes, checking the correctness and style of references. There has to be a proper uniformity in everything. we have to see that if they have, authors have taken the permission for the tables and photographs, and most important, check for plagiarism. So at this stage, I can say what we must do when we think of writing a book. Do choose the appropriate title of the book to describe the reach of the contents whom you are writing it for. Prepare the table of contents to touch upon all aspects of pediatric anesthesia. We did refer to few books and then decided our own table of contents. Select appropriate title of the chapter for the right author. Decide the deadlines for completion of the manuscripts. You have to convey the authors about the deadlines. Give clear guidelines for preparing the manuscript. Edit inspecting overall construction of the topic and layout. And pay attention to the details and flow of the chapter. Check images and tables for appropriateness. So what sort of guidelines we need to give to the authors? There has to be some uniformity in the manuscript. So normally we ask them to write it into the double space, type it into the double space. All the material, text, references, tables, figure legends, and in a single word file. Text font should be uniform and with margins left on 4 sides and page number at the bottom. Each author should write his name and affiliation, degree, and all the information under the title, and necessary permissions for any copyright work. References should be cited sequentially at the end of the manuscript, and they should be also written in superscript in the contents at the appropriate place. Standard Vancouver style of references style should be used with index medicus abbreviations. Uniform headings, uniform format for the headings and subheadings, and there should be acknowledgement or the disclosure before the references. If you have written a manuscript, if your institution or any company is sponsoring your manuscript, then you have to write the disclosure. Tables should be self-explanatory. There should not be duplication of the text material in the tables, and they should be numbered sequentially. Brief title for each explanatory matter in the footnote of the table. Good quality of photographs. If you are inserting the photograph, there should not be any unwanted areas seen in the photographs. Written permission for borrowed figures should appear in the legend of the figures. So what are the don'ts? Do not start without deciding a proper solid plan. We had to take at least 3-4 meetings before you could actually put down the plan. Do not rush to set the deadlines which may be impossible to meet. You know, all the people professionals are busy in their life and they may not give the manuscript in time. And it does happen. Do not let author deviate from the guidelines. Do not accept superficial handling of the topic. The content should be in depth and strive for perfection. And most important, do not lose the sight of the goal. Now, a word about plagiarism. What is plagiarism? There are international laws about plagiarism. Copying paragraphs or statements of any other author is unethical. Acknowledgement must be given when another author's statement is quoted. Full acknowledgement and proper citing of the original source must be done in detail. Copying of research material, processes, tables, and equipment is also unethical. Paraphrasing acceptable if proper inclusion of the referencing is done. Paraphrasing, you should not change the meaning of the contents. If you are putting it in other words, you should not change the meaning of the content. If the author has already published his work in previous any book, resubmitting the same thing again as a new is not allowed. There should be a referencing done. So what actually the laws of copyright and permissions say? All approvals to reuse text, tables, images, or artwork from another source must be in writing from the copyright holder. External or third-party permissions from another publisher may take time and may incur fee. It does happen. You have to, that is why you have to do it well in advance. If the images of specific equipment is easily recognizable because of the logo or the nameplate, and if you are putting that picture in the manuscript, the permission in writing has to be taken from the manufacturer. Permissions in writing from institutions or individuals for images owned by them. If you are including any photographs of the patients, just the eyebars or blurring is not sufficient. Patient's written permission has to be taken. So all these things have to be complied with. Now I'll just inform you about the salient features of our book. The book starts with a page on historical milestones in pediatric anesthesia. There are 40 chapters divided into 6 sections: basic principles, anesthetic management, subspecialty anesthesia, special problems and situations, medical disorders, anesthetic techniques and procedures, and notes on allied topics. All the anesthetists, 59 contributors, are all from all over India, and they are all experienced teachers, and they have given excellent contents. There are essential chapters by other specialists from radiology. He is a HOD from KEM, and he has given the details in reading the chest radiograph, and he has given umpteen number of pictures, more than 40 pictures of clinical scenarios, different conditions which we see in the hospital actually when we are practicing pediatric anesthesia. The cardiologist is HOD from Wadia Children's Hospital, and she has given details of how to read a ECG and given the pictures of images of different ECGs in different clinical scenarios. Pediatric medicine, he is from KEM and pediatrician, and he has written on common elements in pediatric population and what are the anesthetic implications. Transfusion medicine has given, that's also from KEM. Appendix is in 3 parts. First is the syndromes, which we have mentioned clinical features along with anesthetic implications. Drug index, we have divided those into different categories like antibiotics, anticonvulsants. So it's very easy to refer. All types of drugs, we have put them into categories, and we have given the contraindications and along with drug dosages. Handy formulae and tables for everyday use. And a unique feature of this book is the photo gallery. There are about 46 photographs of abnormalities in children at different age groups, and which everyone may not be able to see in everyday practice. We were pleasantly surprised. This book was released in April 16, and we got this review in January 17. This was a review given by Doody's Review Service, and they have given it under different headings. They have described the book as this is a soft cover, glossy, fact-filled compendium of current pediatric anesthetic knowledge and practice in India. Although it runs to 550 pages, it is very simple and direct in presentation, relying heavily on information boxes, well-chosen graphics, learning points, and bullet points to convey its information. The next heading is purpose. The purpose of this book is to provide a clear roadmap for understanding principles and practical approach to pediatric anesthesia, a laudable goal and one well achieved by this book, also very practical in a book that is clearly much cheaper than the raft of pediatric anesthesia books released in past 2 years. The editors and 59 contributors from major pediatric hospitals and university centers throughout India have assembled and present the material very well. There is a little inconsistency throughout, with some chapters highly referenced, while others have only suggested reading. Here I would like to confess, we added allied topics as 3 chapters: ethics, these are non-clinical, ethics, safety, and simulation. And there we have given only suggested reading. Audience, the simple and direct presentation means easy access for students, residents, fellows, and even attendings seeking a quick check on facts or details when working with children. Regrettably, none of the authors are known to me, but all seem to have well-documented connections to major pediatric care centers. Just 2 slides. And at the end, they have given the assessment in short. Overall, this is a very fast-paced, concise review of a massive topic that is well covered and delivered in 500 plus pages at a reasonable cost, with very clear graphics and good pagination to make learning straightforward and memorable. So the journey of writing a book, I have put it down in few lines. I wish to express my gratitude to God Almighty as He adorned me pediatric anesthesia as my duty. Writing a book has been the pinnacle of my career. Truly, I enjoyed pediatric anesthesia year after year. Nandini and I shared the same wavelength. We did consider only the quality, not the page count or length. Frequent calls and emails to our multiple authors, chasing them to complete their respective chapters. Editing, re-editing, and proofreading, long hours we met to bring principles and practice of pediatric anesthesia up to date. This is the front and back page of our book, and thank you very much for